What is phosphorus? Phosphorus is the second most abundant mineral in the body. Phosphorus is component of bones, teeth, DNA, and RNA. In the form of phospholipids, it is also a component of cell membrane structure and of the body's key energy source, where phosphorus produced, synthesized. Your body cannot make phosphorus. The body only gets the phosphorus it needs through the food you eat or from supplements. Phosphorus can be found in foods, organic phosphorus, and is naturally found in protein-rich foods such as meats, beans, nuts, poultry, fish, dairy products, cheese, milk, cottage, yogurt. What functions does phosphorus do? The main function of phosphorus is providing structural strength, integrity, and formation of bones and teeth. It plays an important role in how the body uses carbohydrates and fats. It is also needed for the body to make protein for the growth, maintenance, and repair of cells and tissues. It is also required for biochemical processes at the cellular level. Low phosphorus causes. Because phosphate is found in many foods, it's rare to have a deficiency unless you're malnourished. There are two types of hypophosphatemia, acute and chronic. Both of their causes are different. Acute hypophosphatemia comes on very quickly, whereas chronic hypophosphatemia develops slowly over a long period of time. Acute hypophosphatemia is usually the most severe and common type of hypophosphatemia seen in clinical settings. It includes diabetic ketoacidosis, chronic alcoholism, burns, respiratory alkalosis. Typically, chronic hypophosphatemia is caused by issues with the kidney and their ability to absorb phosphorus, malnutrition, semi-starvation, hyperparathyroidism, hormonal conditions, vitamin D deficiency, issues with electrolytes, diuretics, and antacids. High phosphorus causes. High phosphorus is often a sign of kidney damage or disease. Healthy kidneys balance the phosphorus in your body by removing any extra phosphorus from your blood. If you have kidney disease, your kidneys may not remove extra phosphorus. Other possible causes of hypophosphatemia include low parathyroid hormone levels, hypoparathyroidism, damage to cells, high vitamin D levels, diabetic ketoacidosis, high levels of acids called ketones in the blood of people with diabetes, injuries, including those that cause muscle damage, serious body-wide infections. Reference ranges. Adults 2.8 to 4.5 mg per deciliter. Children's, females 1 to 30 days 4.3 to 7.7 mg per deciliter. 1 to 12 months 3.7 to 6.5 mg per deciliter. 1 to 3 years 3.4 to 6.4 mg per deciliter. 4 to 6 years 3.2 to 5.5 mg per deciliter. 7 to 9 years 3.1 to 5.5 mg per deciliter. 10 to 12 years 3.3 to 5.3 mg per deciliter. 13 to 15 years 2.8 to 4.8 mg per deciliter. 16 to 18 years 2.5 to 4.8 mg per deciliter. Males 1 to 30 days 3.9 to 6.9 mg per deciliter. 1 to 12 months 3.5 to 6.6 mg per deciliter. 1 to 3 years 3.1 to 6.0 mg per deciliter. 4 to 6 years 3.3 to 5.6 mg per deciliter. 7 to 9 years 3.0 to 5.4 mg per deciliter. 10 to 12 years 3.2 to 5.7 mg per deciliter. 13 to 15 years 2.9 to 5.1 mg per deciliter. 16 to 18 years 2.7 to 4.9 mg per deciliter. Critical panic value. Lower limits, less than 1.0 mg per deciliter. Upper limits, more than 6.2 mg per deciliter. Clinical reportable range, CRR. 0.31 to 20.0 mg per deciliter. Analytical measurement range, AMR. 0 to 9.0 mg per deciliter.